Hi, everyone. Welcome. We are excited to have you join us all today for a conversation about healthy housing as a pathway to health equity and well-being. When we press open the floodgates to get in here, it takes a bit to get everyone in. So we're just going to wait till we get them all in, and we should start in about a minute. Thank you. Hi, everyone. Welcome. My name is Melissa Navas, and I use she, her pronouns. I'm a member of Metropolitan Group's public health team and am excited to be here moderating this panel. I started my career as a former reporter and it's been a minute since I've had the experience to feel like I was in a newsroom again or talking to people in this way. And so that makes me happy. I'm also really honored to be here today on behalf of Metropolitan Group because some of the topics that we are talking about today are things that my family faced and still does face in the San Francisco Bay Area where I grew up. And so this is a really personal conversation for me. If you are newer to Metropolitan Group, we are a social impact communications and strategy firm working at the intersections of public health, environment and sustainability, and social justice. And today's conversation sits firmly at that intersection. We have offices in Portland, Oregon, Washington, D.C., and a sister company in Mexico City. And I'm based out of our Portland office. In a moment, I'm going to introduce you to our panelists. We're going to dive into a discussion, and it's pretty amazing panel that you will be able to hear from. We'd like this to be more of a discussion than a lecture, and so if you have questions or comments, you can please type them into the chat. My colleagues Cirili and Jennifer are going to be monitoring it, looking for your questions or any themes that you're noting. And if you do have a question for a specific panelist, just note that when you ask your question, and we'll make sure to direct it toward them when the time comes. Also, Zoom has an accessibility feature that we use for our webinars. So if you look for a globe icon at the bottom of your Zoom window, if you click on that and choose live transcript, you'll be able to see Zoom transcribe the audio of this session in real time. We encourage you to share on social media if you'd like, using the hashtags Power of Voice or Housing Justice. And please be sure to tag or follow us on Instagram at Met Group. Thank you so much for joining us, and we're going to get the conversation started. So I'd like to introduce our panel. And as I share these brief introductions, we will drop their full bios in the chat. So first, we have Amanda Reddy, who is the Executive Director of the National Center for Healthy Housing, founded on the premise that better housing can be a powerful platform for better health. Amanda's work focuses on working with communities to prevent housing-related illness and injury by implementing evidence-based and equitable policies that improve housing quality. Ed Johnson is the Director of Litigation at the Oregon Law Center. He has been a legal aid lawyer in Oregon since 1996. His work focuses on fair housing, subsidized housing, housing preservation, and homeless rights litigation. Jasmine Hall Ratliff is the Executive Director of Build Missouri Health, a statewide nonprofit that works to support community-led innovations to radically change systems that result in equitable health outcomes. Throughout her career, Jasmine has focused on achieving equity across communities particularly for communities of color and LGBTQ plus individuals. Steph Jarem is Oregon Health Authority's Director of the Office of Health Policy. She serves as the director of Oregon's 1115 waiver, which allows states to test new approaches to their Medicaid programs. She partners on health system transformation efforts that are driven by the legislature and the Oregon Health Policy Board. So when our team first started thinking about convening health equity, convening about health equity at its core, our conversation kept looping back to housing. And I live in Portland, where we're one of the cities across the nation that is struggling to get and keep people housed. And the Portland metro region is making progress on some short and long-term approaches to supporting people who are unhoused, but there's a long way to go, and it takes a toll on the people who live here, on everyone. There was a Supreme Court case that originated focused on Grants Pass, Oregon. You may have read about it in the news recently. So this decision had just come down, that ruling that the cruel and unusual punishment clause of the Eighth Amendment did not prohibit cities from enforcing laws that regulate camping on public property, even if there aren't enough affordable, safe housing options for people to turn to. Beyond homelessness, our teams work on climate and environmental justice and are continually looking at how housing options are affected by rising temperatures and water levels, and by the policies that make it easy for companies to put toxic waste and highways in communities of color and places where people earn less money. According to Housing Matters, in 2021 alone, 1 in 10 US homes were damaged by disasters. That's 14 million homes, and that happened in 1 year. From a social justice perspective, past and persistent policies make housing increasingly unaffordable. Elected officials, banks, and other institutions continue to lock families out of housing and generational wealth. Housing has always come up in our public health work as a social determinant, and those factors that have an outsized influence on people's ability to reach their best health and well-being and to create the future they want for themselves and their family. Housing and educational outcomes, housing and safety, housing and social connection, housing and career stability. It's like a Jenga tower, and if you pull a piece out, healthy, affordable housing comes crashing down. So we're delighted when we reached out to some of our collaborators who carry various pieces of this story, and they all said yes. We're going to start with some words from each of our panelists. They'll weave a story from their unique perspectives on the connections between housing and health, some of the urgent challenges and opportunities in the policy and practice arena, and ideas of innovative and transformative actions moving ahead. So we'll have a little discussion with panelists after they share, and then we'll have ample time for your questions. As a reminder, you can use the chat, and we will bring them into the discussion. All right, panelists, let's dive in. We're going to start with a framing question, and each of you will have 5 minutes to address it. It's a big one. We warned them coming in, but to start, the question is, what are the essential actions to advance housing equity as a public health issue, especially with the amplifiers of structural racism and climate change? And what is the best role for philanthropy, the public sector, health advocates, and others to play? So Amanda, will you please start us off looking at housing and health connection?
Thank you so much for having me here today. I really appreciate that. And, I think as you said in your opening remarks, and probably everybody who's joining the conversation today, many of us are well aware that housing is one of the most well-documented social determinants of health and well-being. And it's not just because we spend a lot of time there, although we do, right? I think about, on average as Americans, we spend about 70% of our time in residential environments. Many of us have heard that statistic that we spend 90% of our time indoors. I'm not sure all of us appreciate that most of that time is actually in and around our homes. And if you're very young or very old, or you work from home or in other people's homes, or have certain types of disabilities, that percentage of your time may be even greater. For instance, a majority of children under the age of 5 in this country receive care in home environments, whether that's their own home or a relative's home or a neighbor's or a family child care situation. So homes are also really important settings as early learning environments. But it's not just because we spend so much time here. It's because housing is also a basic human need and a human right. And for many of us, a human desire, right? We dream of sort of the homes that we're gonna create. And yet somehow for, despite this importance that housing plays in our lives, for too long, we've neglected our housing stock in this country. For most of us, when we think of homes, we think about security and shelter, and home is often the epicenter of our lived experience. But homes that are poorly constructed or poorly maintained or cost too much to rent or heat or cool can really significantly impact the health and safety of residents. About 40% of homes across the country have one or more health or safety hazards that can be dangerous to people's health and well-being and cause significant illness, injury, even death. And it's really worth calling out that these risks are not equally distributed. For example, Black Americans are twice as likely to live in homes with severe physical problems when compared to the general population. And these disparities in housing quality really drive and exacerbate disparities in health outcomes. So as a result, we're all too familiar with the statistics that Black children are more likely to be exposed to lead, more likely to have and die from asthma, are at increased risk for injuries at home, even when we see injuries decreasing among white children. And the ways that housing can impact health go beyond housing quality, which is the focus of my organization's work. And I want to acknowledge that we're going to hear a wide range of those perspectives today and that they're interrelated, right? Affordability, stability, whether or not you have a home in the first place, the physical and social context of where your home is located, all have a tremendous impact on health and well-being. And one reason I'm excited about this conversation today is the potential to really deepen those relationships and acknowledge them as we consider more holistic solutions for our community's housing problems. But even within NCHH's scope of housing quality, it's our understanding of what that is constantly evolving beyond the traditional ways that many of us, if we hear housing quality and health, think about how housing impacts health. Things like lead poisoning or asthma, older adult falls, carbon monoxide poisoning, your radon exposure leading to lung cancer, fire injuries, those kinds of things that it might conjure up. For example, some of the things that I see coming up over the last few years is that infectious disease was actually at the center of early work to improve housing conditions in this country, with overcrowded tenements being recognized as a significant influence on the spread of diseases like cholera and typhoid. But our focus fell away from infectious disease for a while. But something happened in the last 5 years. I wonder if anybody can guess what might have happened in the last 5 years to make us start paying attention to that link between housing condition and infectious disease again. A study was published by Ahmad et al. In 2020, looking at the association between housing conditions, poor housing conditions, and COVID-19 incidence and mortality, and found that with each 5% increase of households with poor housing conditions, this was data at the county level, there was a 50% higher risk of COVID-19 incidence and a 42% higher risk of COVID-19 mortality, even when they controlled for other risk factors that we know contribute to that. Mental health is another outcome that I think is often overlooked or not taken seriously enough, or attributed to other stressors in the housing space, like housing quality or housing stability or affordability. But a study I've been thinking a lot about over the last few years was a study by Coley et al., published about a decade ago, that found that compared to these other dimensions of housing stability and affordability and even housing type, poor housing quality, amongst those things, poor housing quality was the one that was most consistently associated with children and adolescents' development, including worse emotional and behavioral functioning and lower cognitive skills. That's pretty tremendous, right? Of knowing how stressful it is to not have a place to live or be worried about whether you're going to have a place to live. And housing's central role in climate change is another place where there's increasing attention, both because the residential sector accounts for about a fifth of our nation's greenhouse gas emissions, but also because it's where we take shelter from climate related events. And I think we're going to have an opportunity to dive into that more later in the conversation. But as I wrap up my answer to this first question, I'd just like to leave you with something that housing isn't, right? Up top, I started with all of these things that housing is, right? It's a right, it's a need, it's a well-documented social determinant of health. And I want to leave you with the fact that housing isn't just a problem. I mean, for many communities, housing is a problem. In some communities, it's the problem, but it's also a really powerful solution. There was a framework study a while back that looked at what people, including the general public and decision makers, understood about housing quality. And one clear finding was that people already really understand the connection between housing and health. They get it. You're right. Housing conditions can impact your health. But another important finding was that they also understood this to be a big, complex, unsolvable problem. And it is big and it can feel complex, but it isn't unsolvable. Housing related illness and injury is preventable, full stop. We know how to find hazards, we know how to fix them, and we can achieve a lot of good, really nothing short of transformation by making that kind of investment.
Thank you, Amanda. Ed, I'm turning to you next. Your work is illuminating major cracks in that health housing connection. And what does the recent Supreme Court decision and other policy decisions mean for this?
Thanks, Melissa. It's really great to be here with you all today. I should confess right up front that I am the lead counsel in the Grants Pass case that the Supreme Court recently heard. And more broadly, I've spent a good portion of the last 30 years representing people who have been forced to live outside. And so that's kind of the perspective that I'm coming from today. The Supreme Court decision did not go the way that we had hoped. 6-3, the judges ruled that cities can, under the Eighth Amendment, cruel and unusual punishment clause, criminalize people who are living outside, even if they have nowhere else to go. And I'm going to talk through sort of what I think the implications of that decision may be, although it probably will be years before we know. I want to start, though, by kind of dovetailing with what Amanda was saying, which is, homelessness is a housing problem. And more broadly, it's an economic problem, but it is not a crime. And the good thing about homelessness as a problem is that it is solvable. We know the cause and we know the solution to it. And I'm going to talk through that a little bit, but I first just want to acknowledge that this is a particularly scary time for our homeless neighbors because not everyone agrees that being homeless is not a crime. The good news is that 6 judges in the Supreme Court do not get to decide what kind of communities we live in. We get to decide that. And we all have a role to play in making those communities the communities that we want to live in. But things are at a crossroads right now. It's a very fluid environment. And in my view, there's a clear right way to go and a clear wrong way to go. Remarkably, the richest country in the history of the world, the United States, is 7.2 million housing units short of what it needs to house its population. That is a staggering statistic that I think can only be described as a massive systemic failure based on decades of bipartisan failure on policy decisions. And the reality is we cannot litigate our way out of that problem, and we certainly cannot police our way out of that problem. The only way to solve that problem is to find the political will to build more permanent, affordable, supportive housing. When you get the opportunity to meet people who are living outside and get to know them and see their daily struggle, the health consequences of this housing crisis are evident. Hyperthermia in the winter, and heat exposure in the summer. I mean, air quality now is an increasingly big threat. All of this is getting worse as climate change accelerates. In addition, there's just the daily struggle to find food and water, an available toilet, other basic hygiene, medical and dental care of all kinds. And when you layer that with the statistics around increased risk of traffic fatalities and, increasingly lethal supplies of narcotics on our street, All of that adds up to a really depressing statistic that the mortality rate for unhoused Americans has more than tripled in the last 10 years. And all of those things that I just mentioned disparately impact people of color for a variety of layers of systemic racism that leads to people being homeless more frequently. All of that is exacerbated by this political, this very short-term thinking and political messaging that elected officials want to get tough on homelessness, as though it weren't tough enough. That mindset puts people's lives in jeopardy. It wastes money, but it does nothing else. It will just make matters worse. It's going to move us further away from our solution. It will increase the number of people that are living outside, and it will worsen this public health crisis. There is plenty of reason for hope, though, even now when cities are feeling emboldened to criminalize their homeless neighbors, the victims of their failed housing policies. And lots of cities have not gone that route. As I said at the top, the good news is we know the cause and we know the solution. And it has to do with finding the will to fund and site and build more affordable housing. There are plenty of examples of how this has worked. Veteran homelessness has been cut in more than half by the HUD-VASH program, which does exactly what I just described. It integrates supportive housing with comprehensive services. And, this is a doable, not easy, but it is a doable task, and it is much cheaper than the alternative routes. There's also bipartisan support for zoning reform in many states, including Oregon. We have to have a place to build this housing, even if we fund it. Tenant protections are a really important piece of this, and we found out that they worked during the pandemic. Unfortunately, many of them have lapsed, but they still work. We have to keep people who are inside while we're working to get people who've been forced outside inside as well. So I want to leave you with a somewhat less depressing note, which is, I believe that this problem will be solved. And I hope it gets solved before we cause even more human suffering. There is a path forward, and it's a two-sided coin. On one side, we have to stop the political stunt of saying we're going to get tough on homelessness, and we have to dedicate ourselves to the hard but doable work of building the housing we need so that everyone has a safe place to live.
Thank you, Ed. Jasmine, we've talked about how the kinds of decisions that Ed is talking about go way back, creating inequities that are still in place. What are you finding in Missouri, and what are some of the alternate actions that you're taking?
Yeah, so thanks first for inviting me to this conversation. I want to start with a little bit of a sense of geography and demographics of St. Louis for those who may not be familiar. If you look at the city on a map, it's sort of ovalish shaped with a north and south divide separated by a major highway, and then two other highways that go through the city, one through the north and one through the south. And it's home to about 300,000 residents, and that's just the city itself. The city and county, the region itself are a couple million, but I'm going to focus a lot of my comments on the city. And then from a racial demographic space, it's about 45% Black or African American and 43% white. The city is still to this day and historically has been considered one of the most segregated in the nation, with the majority of Black folks that live on the north side and a little bit of a pocket sort of on the southeast side. These economic and racial injustices started with Missouri choosing to join the Confederates during the Civil War. Missouri was a slaveholding state, and through the Civil War, they fought on the side of the Confederates, and then they experienced, after the Civil War, a great migration of folks from the southern part of the U.S. going up into northern cities, northern compared to the south, such as St. Louis. And so the next systemic injustice frontier was housing. So we had restrictive zoning that pushed Black residents out of certain neighborhoods. We had deed covenants that in some cases for some homes still exist on the record, even though, you know, the climate of course has changed around deed covenants. Those of course barred Black residents from owning or renting homes in parts of the city. And then during the mid-20th century, as occurred in a lot of other cities across the country, redlining practices divided the city up into the desirable and undesirable parts, where folks were essentially pushed out of being able to get mortgages and afford housing in entire city sections and neighborhoods. And a lot of those redlined areas that were colored orange and red were in the North Side. And then at the same time, of course, white families were given more opportunities to build wealth and access better resources, with a lot of them living in the green colored areas of the city. So these practices over the years pretty much cemented the racial and economic segregation, relegating Black communities mostly to the North Side and leading to concentrated poverty and disinvestment in that part of the city. And unfortunately, the legacy of those injustices persists today. We have the predominant Black neighborhoods in the North Side of the city that continue to face higher rates of poverty, lower property values, and higher health disparities. And again, a major highway runs through the North Side. And so as you can imagine, there's there's car traffic and smog and pollution. A lot of industry has built up on the North Side, and there are still residents and homes in that part of the city. So the air pollution has increased even more. All of this has led to higher rates of asthma, other health risks. The homes on the North Side are all very old. St. Louis City is an old city with a lot of old homes. A lot of those homes still have lead paint. And so the children in North City are also suffering from higher rates of lead poisoning. And again, these are also predominantly Black children. These conditions, of course, have contributed to lower life expectancy and higher rates of chronic illness among residents. And to put it in super stark context, although the city is about maybe 10 miles north to south, there's a life expectancy difference of 14 years between residents in the North Side and South Side of the city. The ripple effects of these historic injustices are evident in the public health outcomes and the disparities we see today. The relationship, as Amanda noted earlier, between housing and health is just simply undeniable and evident in the city itself. We have low quality homes that have poor ventilation, and proximity to environmental hazards are directly impacting the health of individuals and families. However, there is sunshine peeking behind the clouds. We're starting to see a shift towards more equitable housing policies and practices in the city. The city received a huge amount of ARPA dollars, similar to many other cities around the country, and over a series of community town halls and surveys. This summer, the mayor dedicated and announced $3.7 million in ARPA funds towards housing revitalization. And this includes new builds and renovating vacant homes. And a lot of that focus is going to be on the North Side. We additionally have state and local organizations that are advocating for fair housing policies and practices that prevent discrimination and promote integration. And an organization called the Green City Coalition, which is a partnership of the city, the state's conservation department, and other community members, are working to turn vacant lots into green spaces and to help naturally clean the air, both in the North Side and across the entire city. So it's happening. It's starting to gain momentum. There's, of course, a lot of work that still needs to be done, but we are starting to see, a little bit of a light at the end of the tunnel here in St. Louis.
Thank you, Jasmine. Steph, turning to you, Oregon Health Authority is building housing equity into its systems. What does that look like going forward?
Thank you, and thank you for having me today. I'm going to try to come back to the link between health and housing a little bit here, really bolstered by everything that's been said so far. So the current criminalization of homelessness that Ed spoke to leads to the unintended consequence of incarceration, often being used in lieu of housing, which then accelerates a decline in both the mental and physical health for people who are trapped within that system. And the use of emergency systems in place of that stable housing is then far more expensive than preventing care in the first place. And we are trying to think about housing as a form of preventive health care. And that's part of what we're testing that I'll speak about today. I think when we shirk at the cost of providing that equitable access to housing, we then ignore the price that we're all paying one way or another when we fail to care for those who are most vulnerable among us. In Oregon and throughout our country, we see that people too often are moving in and out of homelessness or are living in that state of chronic homelessness due to the lack of affordable housing. And that gets really exacerbated when you have the presence of a medical or a mental health condition, including disorders of addiction. That lack of access to safe and healthy housing can then increase the severity of any illness for anyone, a lot of what Amanda spoke about as well, and has a real disparate impact on people who live at that intersection of multiple categories of vulnerability. When you think about lack of housing, and then you also think about issues related to racism, gender challenges, chronic health and mental illnesses, there's a real public health effect, that cannot be ignored. And so historically, we've had these two separate systems of health and housing. And I think all of us here today really recognize that that housing is a public health issue. Racism is a public health issue. And so we are seeking actions to advance ways to address that within all of our systems. We see that all of the impacts of health and housing and the access to those systems is further exacerbated by historical oppression in our system, people who are facing bias, people who are facing, as I said, racism, homophobia, other harmful experiences while seeking housing or while trying to remain housed, which then shrinks that available housing stock, exactly what Jasmine was just talking about as well, like really just what is accessible to people in our state and country. So in Oregon, we're exploring a number of actions to attempt to remove bias from the health and housing systems by establishing some more housing supports and services as a true appealable Medicaid benefit. So Medicaid is our system that supports low-income individuals. And the importance of connecting these things is that if you are eligible, you are entitled to receive the service, and really trying to support the system to be able to get everyone what they are entitled to. So some of the really basic essential actions that we're taking that we encourage others to explore is really first, the most basic aspect of our cross-system collaboration and strategy across health and housing. We have people serving the same people, organizations serving the same people, but we actually end up creating burden because we are not speaking the same language, don't know who to call, don't know how to make the connections. People don't know who pays for what, even within our systems. And so really starting here has been important for us in the state to build shared strategies and to really expand on what we know about each other. We've seen this really successfully happening at a grassroots level, at our local levels as well, in these systems recognizing the importance of coming together. One of those significant steps is linking our care coordinators for healthcare and our housing case managers. Because right now you have two people, two roles, two systems, yet both positions are often providing case management support to individuals and creating referrals across different systems and providers. And so we've really been working to solidify the relationship and the coordination between those two and to facilitate information sharing between them. Due to systemic racism, mistrust in the system, we have a lot of members in our Medicaid program who don't have diagnoses and don't trust the healthcare system. And so what we are trying to work through is building a foundation between those two roles of health and housing and case management to support someone to get a diagnosis if they desire that, and to get therefore the health supports they need, facilitate trust in the system, and all work together. And so our most exciting work, again, trying to end on a positive note, is that we've been utilizing a waiver, an 1115 waiver in the Medicaid system to support health-related social needs. We have a few. We're doing housing, nutrition, outreach and engagement, and climate devices. But really focusing on housing for today for our Medicaid members that have a clinical risk factor, again, linking that housing to health. And so our focus is on preventions. For example, a person who is hospitalized unexpectedly, can't pay rent, and then loses housing. We're hoping to be able to interrupt that acute situation and keep that person on an upward trajectory. Really trying to be strategic about the use of federal and state funds and understand where a healthcare system and a medical system can come in and serve the right space in partnership with our housing systems. As I said before, a really unique aspect of this is that it's a true Medicaid benefit. And so if you are eligible, then you are entitled to this housing support. In theory, what we are testing here is that this really enhances equity across the state in terms of who has access to these services and where. This includes rent for 6 months. This includes utility supports. This includes a lot of really strategic, supportive housing services. And just to call attention to what Ed was referencing earlier, I mean, the Grants Pass case is based in Oregon. And so we are really trying to wrestle with the challenges of local systems, how they are struggling, what the challenges are. And so thinking about how we get to those solutions together and interrupt some of the challenges to solve the problems.
Thank you, Steph. Thank you to all the panelists for getting us started. I could probably have hour-long conversations with just each one of you, and we'll be here till dinner, and then we can actually start our dinner party. So as a reminder, before I jump into a couple of questions, I see a couple of questions coming in, but please add more to it, direct them to anyone. If they've said anything that piqued your interest, you want to dig in a little bit deeper on some of those themes, please do so. And we'll turn to your questions. Just to start, Jasmine, coming to you, you talked a little bit about what's happening locally in St. Louis, some solutions, things that, you know, the ARPA dollars could be used, are going to be used for. What are some other local, promising local actions that have the potential to shift the Band-Aid, well, from a like Band-Aid on solutions to actually transformation? Oh, unmute. Yeah.
Thank you. The city has an economic development agency, shorthand SLDC, that in 2022 launched a new strategic plan under new leadership. And that plan has a really impressive, comprehensive set of strategies towards economic justice. And the CEO, when he unveiled the plan, was very clear that he is focused in on reducing racial inequities across the city, both from an economic standpoint, a housing standpoint, and overall development. And so that was really encouraging. You know, his plan includes neighborhood transformations, investing in historically disinvested and marginalized neighborhoods, boosting up economic development in a way that starts to shrink economic and housing disparities around the city. Also, the city has passed an ordinance requiring developers receiving tax incentives to set aside a percentage of their units for low-income residents. St. Louis City, just like a lot of cities across the country, is seeing a lot of development and investment and high-priced housing popping up all over. And the city's mayor is, again, attuned into the racial disparities around the city, and especially as it relates to low-income housing and affordable housing. And so she's requiring that if you're going to get tax incentives to build in our city, build homes in our city, you have to put aside a percentage for low-income residents. There is also a group called Tenants Transforming St. Louis that is an organizing group that's very active in holding landlords accountable. You can set all the standards and codes and everything that you need to make sure that affordable housing is high quality and is energy efficient and all those things. But if landlords are not held accountable, then that just kind of, and Missouri is a very landlord-friendly state. And so this group is helping tenants understand their rights. They're helping tenants hold their landlords accountable. And if needed, they partner often with Washington University Law School's interdisciplinary environmental clinic to use the legal system to change landlord practice. There's also, lastly, an interesting effort underway to bring modular housing to St. Louis. And that's one of the up and coming practices. I know we'll get into sort of environment and climate further on, but it's one of the up and coming practices to build homes in a faster, shorter turnaround time with more sustainable materials and in ways that are more energy efficient. And so there's an effort called Gateway Decathlon that is running a competition right now to bring innovative modular housing solutions to St. Louis in hopes of sort of turning St. Louis into a modular housing hub, not only manufacturing them and then shipping them out across the country, but also, you know, placing them here in the city to start to fill some of the vacant and empty spaces that we have with homes that are affordable and that are energy efficient and climate resilient.
Thank you. Amanda, I'm turning to you next. Just wanted to chat with you about how structural racism amplifies the challenges that you're addressing, and where you're taking that work. How are you navigating that within the organization, or what are you seeing?
Absolutely. And I was just going to add to that last question about solutions too. I think one national trend that we're seeing is, thankfully, a lot of communities finding the opportunity to intervene proactively, which is where we really have the biggest opportunity to improve people's health and well-being and actually see the, even bigger returns on investment here. The primary way that we intervene particularly around housing quality is, when a kid shows up with an elevated blood lead level, or somebody's already has asthma that's out of control, or an older adult has a fall. And so I think that's been a real bright spot for us, is seeing a lot of innovation at the local level to not wait to be reactive, but to be proactive. And, I really appreciated also, we've already talked about the significant disparities in exposure, and, Jasmine really helped to reinforce that, this is not by accident, right? It's by design. It's the direct result of historic and ongoing racist housing policy that has been compounded by layers of structural racism affecting other dimensions of housing and healthcare and people's lives. One other way that this is coming up in our work a lot, and that I think is worth acknowledging, is that our field, the healthy housing field, has gotten pretty good at responding to the effects of structural racism, right? We know how to find those housing hazards, we know how to fix them, but a place that I see as an opportunity for growth as a field is really in understanding how we can be actively dismantling the systems that have made our work necessary in the first place. And that includes examining even our own internal practices and thinking about this in big ways and small ways. An example of a small scale action that I like to highlight is, for many, many years, asthma programs that identify and address environmental triggers in people's homes have used supplies, including things like HEPA vacuums, as incentives for participation. And for a long time, the common practice was to hold off on providing these supplies to families until they had completed a certain number of visits, the research study or the intervention, as a way of trying to keep families enrolled. But I think as many of us have been on this journey of anti-racism and confronting that in our own work, we've started to ask questions about, like, what does it say about our relationship with these families, about the trust we have or don't have, that these families we serve, or our lack of confidence in the value of the service that we're actually providing to them if we have to withhold something that we know is actively going to benefit them, right? In this health outcome that we say that we care about, right? To help them control their asthma. And thankfully, more and more programs are abandoning that practice in favor of equipping families up front with any supplies or equipment that might help them control their asthma. And certainly there's a lot more to be thinking about on a systemic level. I'll try and drop in the chat also. I think there was a great conversation on this co-hosted by our colleagues at the Regional Asthma Management Program last December, really looking at racism and housing and asthma, different housing interventions, how we both address immediate and future harm, but also think about, potentially even reparations for past harm caused by housing conditions.
Thank you. Steph, you talked a little bit about the housing benefits coming online this year for the state of Oregon's Medicaid members, and you're beginning to ramp this up. And at the same time, not only this year, but in previous years, you're seeing hotter weather, extreme heat in the state. I was just looking 2 days ago at a map of Oregon and seeing where all the wildfire smoke was going, because I could smell it. We're starting to look more frequently at what air quality index is looking like. So can you talk a little bit about what climate change in Oregon, the challenges that it's presenting as you're trying to do this work, and how is the state addressing that?
Yeah, absolutely. Thank you. So yes, in Oregon, we are reckoning with increasingly extreme weather. The 2021 heat dome caused at least 96 deaths in Oregon, most of whom were home alone and without air conditioning. Oregon is not a state where it's been standard to have air conditioning historically because of what was historically mild weather. And so we're kind of playing a lot of catch up as we are facing record wildfire, record heat, and smoke events annually. And so thinking about what Amanda's been saying about the quality of housing, it really means to think differently about the housing that we are setting up for individuals and whether or not they have access to some of the tools that they need to be able to stay healthy. So, and then I think on top of that, we are also recognizing that in the future, more and more people in other parts of the country and world will be forced to leave their homes due to climate change and global warming. And the Pacific Northwest, as well as other areas, but the Pacific Northwest is likely to be a place where we see people landing again because of the historically mild areas. And I think that's all on the specific climate side of things, but this also impacts the basics around housing stock and housing affordability as people migrate. And as people need to seek these types of supports in their homes. One of the things that we've been talking about as well in Oregon is that the median age for people experiencing homelessness is increasing and is projected to continue to increase as many baby boomers find that they lack sufficient retirement resources to stay housed. Adding to the structural racism that results in less generational wealth, the redlining that's we've been talking about as well, and that disproportionately impacts people of color, will continue to disproportionately impact older people as they can no longer work. And many of those older individuals also have the same risk factors that make these extreme weather events so risky. So given all that, Oregon sees the connections between these extreme weather events and our health impacts. A dozen years ago, we built some flexibility into our Medicaid system to allow for purchasing of air conditioners for preventive purposes. Thinking about people who have, for example, COPD or heart conditions that are worsened by heat and smoke. Buying an air conditioner for someone with these health risks is incredibly cost effective. Likewise, considering a family during a smoke event with a child who has asthma, who can now sleep at night and then show up to school more ready to learn. So similar to our housing benefit, we've now added these climate devices. So thinking about air conditioners, air filtration devices, portable heaters, for example, personal generators in areas where we know because of smoke and wildfire, we're preemptively shutting off electricity, and someone may need electricity for the devices that help keep them alive. We've added this as a benefit in our Medicaid system, and our state legislature has also allocated funds to help support getting these devices into the hands of people who most need it. So I would just recognize that this is not yet upstream. This is really just mitigating the effects of climate change. And we are trying to be more ready for it, but there is still a lot of work to do. And I think all of this is really important to be connecting to our housing challenges as well.
Thank you, Steph. I want to turn over to Jasmine to touch on this question on climate as well and the challenges.
Yeah, so we have obviously the heat is also, it's a constant joke in St. Louis about how hot it gets all the time around here. But we also have, just for Missouri as a whole, tornadoes, being in the Midwest, and the housing stock around the state, is not prepared for the increase in tornadoes that are likely to happen as a result of climate change. We had in Southeast Missouri a couple of counties that last summer first experienced a tornado, and then about 3 months later had flooding due to some major rainstorms. So if you can imagine those families trying to repair the damage from the tornadoes, now having to deal with water coming into their homes. Similarly, here in St. Louis last summer, there was a major couple of days of rainstorms that created huge flooding all over the city and into the county, where again, our housing stock is just not prepared for those types of extreme weather events that are occurring in the city. That river, that it's called River de Pere, there are efforts now, or at least conversations. They're not quite turning into efforts just yet, but folks are starting to try to look at ways to mitigate and contain that river and create more flood zones and things like that to avoid that happening again in such a catastrophic way as it occurred last summer. And then again, I mentioned the Gateway Decathlon with the modular homes, that would be more energy efficient to combat the heat and the cold, and be more resistant to the wind and the storms and all those things that are coming. And then in Kansas City, there's a private developer who has built a major apartment building using passive house design, which is one of the leading ways of creating more energy efficient homes. That the current building is market rate, but he's now looking at another development that would include affordable housing. And he's preaching the gospel of this kind of design that will create healthier, more resilient homes, and hopes to work with folks on the St. Louis side to bring some of those practices here. So there are some ways to start to combat this, but it takes money and it takes will.
Thank you. Amanda, you wanted to touch on this question as well.
Yeah, I think it's worth mentioning that, when everybody's, understands that the residential sector has a place to play in mitigation. And I think when we're thinking about adaptation, we're thinking about the importance of housing as a place we shelter from climate related events, right? Whether it's extreme cold or extreme heat or flooding or these high wind events or wildfires, all the things that we're talking about. But I think there's another aspect of adaptation that needs to be addressed also, which is people need to be actually safe when they're inside their homes too, right? It's not acceptable for people to be sheltering from a storm but being poisoned by their home or having their asthma exacerbated. And I think some promising news here is we have a lot of examples of interventions where we can have co-benefits across the spectrum of mitigation and protecting us from climate related events and also from legacy environmental injustices. So a couple examples of that are replacing old leaded windows, right? Leaded windows are a significant source of lead poisoning. It's a friction surface. It's where we tended to put lead paint when we put that paint in homes because it was expensive. And when lead programs go into homes, they're trying to stretch their dollars, so they tend to put in the cheapest windows they can possible. Weatherization programs going into those same homes may skip windows because they're such a high ticket item, but we really have an opportunity and have research to back up that if we actually replace those old leaded windows with more energy efficient windows, we can get rid of that legacy exposure to lead. We can improve thermal comfort. We reduce emissions. We improve home values. We create jobs. Really, we can advance a number of agendas. We can say similar things about gas stoves in terms of providing both cleaner energy source as well as reducing significant exposure to combustion byproducts that exacerbate asthma and cardiovascular and other outcomes. So I think they're just this idea of co-benefits and also thinking about the opportunity to make sure that homes are a safe place to take shelter is really important. And the final thing that I would just note here is I really appreciated Steph's comments about the extreme heat here, and just noting that while these co-benefits are great, they can't be our only criteria. And I think extreme heat is a great example of that, where we're increasingly seeing communities across the country adopt maximum heat provisions in rental ordinances, right? We're all familiar with minimum heat requirements during the heating season. We don't think it's okay for people to freeze in their apartments. That communities are recognizing that even though it might, create more energy emissions, that it's not okay for lower income renters to be suffering extreme heat temperatures in their apartments.
Thanks, Amanda. I'm going to turn to our first audience question. It comes from Missy, and it's for you, Ed. Question here is that you mentioned that there's a $7.2 million shortage with housing the American population. What do you think is the #1 action step that each American can take to daily to decrease this deficit?
So unfortunately, it's a 7.2 unit shortage, which is going to be harder to overcome. But I think the thing that everyone can do is participate in the public dialogue and use, the connections that you have to talk about this problem. I mean, there is a counter messaging effort afoot, and it involves, false stereotypes about people living outside and falsely says that they choose to do that. I mean, that's the ultimate form of gaslighting in an environment where there is not nearly enough housing. Just talking about the various pieces of it, if you have, relevant expertise, it's not just the funding, although that's a big piece of it. We have to figure out a place where we can build it, and, zoning restrictions often intentionally hinder housing density and make it impossible to build multifamily housing. I know Oregon is working on that right now, and so are other states. I've also heard that we've disinvested from construction industries. There aren't enough people who know how to build multifamily housing. Like, sometimes we get focused on the money and we forget there are other steps. And like some states like California and Oregon have actually funded, these programs, and then people are frustrated that it takes time for these units to come online. Well, the reason is there may not be a place to build it, or, and so just talking about that and engaging with people in whatever space you have where you might be able to persuade people. I think the public dialogue on homelessness has not been going well. And I'm hoping that we can turn that boat around, but it is going to take all of us talking to people, learning a little bit, getting educated, and engaging wherever you can.
And you're reminding me of something that I heard Brian Stevenson say long ago, which is also thinking about proximity. So oftentimes there's this othering that happens with people who are houseless. And he would say, one of the things that he challenged everyone to do is be more proximate to people or issues that you do not know, that you did not live, that you have not lived yourself. And there in Portland, there are a couple of things that I've been involved in, and this could be true in all of your communities. One of them is there's a nonprofit here called Cultivate Initiatives that actually will host, one thing that they do is host events where they're inviting unhoused neighbors and housed neighbors together for like a summer picnic and gathering, and people are talking to each other, engaging, it's a party, but it removes that barrier of, I'm afraid of you, or I don't know you, and you're in my community, but I don't know if I want you to be there. That sort of notion. And then the other thing is, in all of our communities, we have a point in time count, which I participated in, volunteered in, and that you're going out and you're participating in a count that ends up feeding toward an estimate of how many people are living houseless on the streets on a given day. But in that, you are also getting to interact with people and really getting to hear a little bit of their story as you're asking questions. So our next question comes from Ty. This is a question for you, Steph. Some agencies require that a person in need of utility or rental support provide some good faith money. Example, half of an overdue electric bill before they will assist. Are there similar requirements with the program that you mentioned?
Fortunately, no. We, as part of the Medicaid program, there are no requirements for that aspect. And in Oregon, Medicaid is free to all individuals who are eligible. I know that that's not the case throughout the country, and that many states have work requirements or are looking to add those requirements. And I think, in particular, thinking about housing, as we dive deeper into our cross-system understanding and looking at cases where people are spending over half their income on rent alone, the idea that additionally adding premiums or expecting to see some of the skin in the game concept does not support the preventive approach that we're talking about when we think about really the long-term impacts of somebody being able to have access to preventive healthcare. That's really upstream for us. So no, we don't have that. We also do recognize, I saw another question in there just about the cost of running air conditioners. We do support some utility assistance for those who are eligible through our program. I think this is an ongoing need and question. There's no use in having an air conditioner if you can't afford to run it. And so those are things that we are also working with county programs and other programs to understand how we can extend that type of assistance over time. We also want to provide the unit, the air conditioning unit, for example, to the individual, because they are the one who need it. And so that means that it is portable and that they could carry it with them to a new location if necessary. It's really tricky when you start to get into it, which I'm sure many of you all know, but if someone is entitled to something, but it requires a change in the home environment where they are renting to be able to work with the landlords or the property owners, all of that is really difficult. And you also can't prevent that person from accessing that benefit. And so we are trying to be really thoughtful about this as we approach it. And, we would love to be installing mini splits or heat pumps that can do more. And I think at this point, we're building towards that in the future someday, but not for right now.
Thanks for answering Mary Ann's question that came in through the chat as well. I'm going to turn to Ed. Ed, question from Sarah was if you could talk more about the impact of the grants pass decision.
I mean, I certainly could at length, but I think what I said earlier is just kind of it's early to say. And I guess what I would say about where we are right now is that cities have a choice to make. It's important to remember that this, even though it was an important legal issue, it was a narrow legal issue that had to do with one provision of one constitutional amendment. And even Justice Gorsuch in the majority, but certainly Justice Sotomayor in her dissent, point out that there are many other paths to protecting people who've been forced to live outside from being criminalized. And the problem with those legal solutions is that they don't give people a home. They just reduce the harm to people that are outside. And so it's really policymakers who are at this fork in the road. And some cities are just going the wrong way. And I worry that the short-term implication of the case could be a race to the bottom, where cities are trying to banish people to the next community, and the next community decides to be even more cruel and banish them as well. I don't know what the end of that game is, but I am also heartened by the fact that many cities are taking the right choice, the right path here, including Los Angeles, which has long been considered a bad example of what happens when you don't house your population. The reality is they are working hard to house people, and homelessness is going down, and their sheriff is refusing to book people who are charged with living outside, pointing out that being homeless is not a crime, and my job is public safety, and I'm going to continue to hold people accountable for criminal conduct, not for their status. We need more of that kind of thinking out there, because that will move us toward a solution, not away from it.
Thank you. Okay, next question actually is probably we're going to go to multiple panelists here. The question, and Steph, I'll start with you and then we'll bounce around, but it was from Kristen, who said, love the frame of housing as a form of preventive care. Sounds like this is something you are all testing. Any emerging bright spots regarding moving political or budgetary will or in efforts to align systems within the state more holistically to address the issues that you're lifting up?
Great, thank you. Yeah, well, the thing that I'll also mention is that our housing benefit actually goes live in 7 weeks. So this is all optimistic, getting ready for it. So, talk to me in 3 months when we're still building this up and seeing what the challenges are. But I think generally the fact that we're able to test this is incredible. I think it shows some of the connections that are being made federally as well as in our state. to really connect health and housing. And we are not the only state doing this. There are over 14 states that I know of, and cities and District of Columbia who are working with Centers for Medicaid and Medicare Services, as well as HUD, to really be testing these connections in different ways. And they're all unique. We're all testing it in slightly different ways. So I think that shows the willingness to make these connections and to think more about that prevention aspect, and the responsibility and the connection of the medical system, to not just wait until someone shows up at your clinic door to solve problems that started a long time ago. So I would say that federal and state, energy around this that we hope continues is going to be one of our bright spots. And then we have a governor who's really focused on this in the state of Oregon, Governor Kotek. This is her #1 priority. And I think, as Ed has stated, and as we've been talking about, it's really a collective identification of a problem of the lack of housing, and there are many solutions to try to solve it. And so trying to weave that blanket together of different things and understanding what our unique roles are has been a monumental effort, and I think kind of takes that laser focus to be able to get us to the next stage.
Amanda, do you have thoughts on this one too?
I do. A couple of different thoughts. One, I just wanted to say, if anybody's interested in exploring healthcare financing for, these types of services, please feel free to reach out. We can point you to lots of technical assistance and sort of help survey the landscape in your state or community, whether that's looking at state Medicaid programs, partnerships with managed care organizations, hospital community benefits through nonprofit hospitals. There's a tremendous amount of potential. But the thing I really wanted to highlight here, in terms of one holistic effort, is that earlier this year, Senator Fetterman put out a proposed bill, the Whole Home Repair Act. This is based on Pennsylvania's experience with whole home repair. This was something that they funded with American Rescue Plan Act funds to provide in Pennsylvania. It was about $50,000 per home as a program available to both single family homes as well as rental units, to address a wide range of housing conditions, resiliency, and energy issues, and also acknowledging that this repair and maintenance need and addressing that is a way of keeping affordable housing on the market, right? So that we're continuing to really shore up that supply of affordable housing. They're proposing to pilot this and hopefully to create a national program that would provide this. And for a lot of communities, this would be really transformative, right? Instead of having to manage all these side-by-side programs for weatherization and lead and falls, right? All of these different grant funding streams, to just be able to go into a home and not make the resident have to navigate all of those programs. Really tremendous opportunity. I put a link in the chat to the press release about that bill, and it's worth checking out as a potential future bright spot.
And Jasmine, wanted to call on you next on this one.
Yeah, Amanda started to allude towards the example that I was going to raise. There's a growing number of hospitals and healthcare systems that are getting into the housing game because they are seeing it as a solution, not only for their own employees are having trouble finding housing. And so they're starting to do it to not only be able to retain and attract employees, but also they're seeing it as a need for the larger community. And so I was trying to find one national resource that has been working with healthcare organizations across the country to get them involved into affordable and just housing and community development in general. But I did want to raise one example that's here in St. Louis. BJC Healthcare is one of the largest healthcare providers in the region. And a couple of years ago, they started a pilot that they hope to be able to continue to grow and expand throughout the region, that is working with regional homeless centers across the city that to bring homeless folks into temporary housing at first, and then hopefully into more permanent supportive housing through the emergency department. So as you can imagine, a lot of homeless folks use the emergency department as their primary care source, and this system will connect with folks as they're being discharged find out their home situation. If they do not have a home and if they are willing to go into the program, they put them into temporary shelter with their partners. They provide, simple things like an ID if they need an ID. They help them get into drug counseling if that's what they need. They help them into all the various different social supports that they may need to get back on their feet. And so they've been looking at this, not only expanding it across the city with other partners, but then potentially even getting other healthcare entities in the region involved also as partners. So that it becomes a real citywide effort.
I wanted to know, we had another question come in, but before that, even a comment of Anne, who mentioned that in the late 1990s, Anne asked a political person in Portland, Oregon, what he thought the most resilient characteristics of people who were homeless were, and he said that they had none and that they were criminals. And Anne says, I believe that that mentality is still very much alive and well today. And so I just wanted to note that as a comment, and I'm going to lead into another question from Brian, who says, being homeless is being in crisis, but has anyone done any work in partnering with mental health leaders or resources to support housing specifically for individuals who have been in the criminal justice or behavioral health systems and need respite housing for their mental health substance use issues? The leaders that Brian connects with in crisis response diversion speak regularly about the lack of housing options for these individuals. So this is open to anyone if anyone wants to jump in here.
I'm unlikely respondent for this question. I was just going to say, I just happened to be in Madison County, New York yesterday at a housing coalition convening where they were talking about this specific issue and some work that has been piloted between different aspects of their social services programs where they are, it's a very rural area, but they are actually leveraging manufactured housing and working with landlords and creating incentives for landlords to sort of stay in the affordable housing space, but to address the needs of this specific population. I don't know that much more about it. I got their business card so I could learn more about it, but I'd be happy to make a connection with you, Brian, if you want to follow up and you could learn more along with us.
I would just agree that this is huge aspect that we're thinking about from the health and housing perspective in Medicaid. We had conversations about focusing on individuals with severe and persistent mental illness in Oregon that are unhoused. And I think in our deeper conversations between health and housing, we really learned so much about the specific needs and supports that those individuals benefit from and how unique they really are in their housing needs. So there was an effort to focus on prevention through the Medicaid waiver, but our state is attempting to serve those individuals in different ways. We talked this, I'm just sharing a little bit of the conversations that we've had, that really the trajectory of someone in that situation and with some of those conditions means that in every step of the way, you want to make sure that we're not going to create some type of cliff or put them in a precarious situation where they're worse off because of our help at the end of the day. And so there was a lot of energy with our waiver to make sure that we're getting the maximum amount of utility, for example, out of our 6-month rent benefit, and that, throwing 6 months of rent at someone who has more severe mental health or addictions needs is not going to actually help them right away. And that we really want to be thoughtful about the buildup to receiving that benefit to launch them on a different path. The other piece I'll just say about this is that Oregon, as well as many other states, are following in the footsteps of California, is focusing our waiver as well on re-entry from carceral programs into some of the housing spaces as well. So some of our supports are focusing on that population, really pushing Medicaid in and getting access to Medicaid prior to release to support someone in accessing housing, accessing the services they need, accessing prescriptions or, whatever screenings need to take place that can be done safely in the carceral setting to really help someone step out on the right foot. And the last piece I'll just say is that for someone who needs treatment services, this is another piece of that rent that we're going to be testing out. If they need to go into substance use disorder or some other type of treatment program that's residential, can our state help pay to keep their housing during that time period? Could be really beneficial in them being able to then return and not be faced with the, either or situation that I think many people are faced with.
Thank you. Okay, I'm going to go back to everyone. Now I'm feeling like I'm switching from reporter to game show host because this is the lightning round. We don't have much time left. So I'm going to ask one question, if you can keep it to like a sentence or two. And that is, what is one priority action that you'd ask people on this call to take? If you've said it before, don't repeat it. But is there something else that you've mentioned that you would want to leave with people? So Amanda, over to you first.
Sure, one is hard, but I would just reinforce the point of keep talking not just about the problems, but about the solutions, right? Just center the fact that these are big, complex problems, but they're solvable and worth solving.
Thank you, Ed.
I think I'm going to go with what Brian Stevenson said that you pointed out. Just avoid anything that's dehumanizing and stereotypes, and call it out when you hear it. You can be almost assured that any sentence that starts "all homeless people" is going to be false and deserves to be called out. We have to break down these false stereotypes and recognize the very specific humanity of this crisis before we can solve it.
Thank you, Steph.
I think partnership, there really is optimism in seeing, everyone who's on this panel and all the other people who are working so hard in this area to make the world a better place. And so I would just say continuing to reach out and find those people to support these efforts is really important.
Thank you. Jasmine.
Someone asked about the Barnes program, and I just put a link in the chat, so I'll just bring attention to that. So I would enhance on what Ed has said around just getting, proximal and understanding those who are homeless a little bit more, because it's not a blanket population. I would also add, to do your best as an individual to stop NIMBYism. If you haven't heard, not in my backyard. That is happening all across the country, not just as it relates to homeless shelters, but also affordable housing, because there is also an image attached, unfortunately, to those who live in affordable housing. And so, if an affordable housing development is being proposed somewhere, you'll see sometimes that there are efforts to stop it from happening. So, whether it's joining your zoning commission and doing other things, or just talking to your neighbor and saying, no, really, we do need this in our community. Just, raise your voice, anti-NIMBYism.
Thank you. Thank you to everyone. Thank you to our panelists for joining us today. Shout out to everyone who stayed on for the last bits of this conversation. And I think something that we were starting to see here, which is what we always hope when Metropolitan Group brings people together, is that you might find someone else, whether it's in the chat or one of the panelists, that sparks an idea for you or another question. And hopefully there's a chance to just connect even more. So for that, we are grateful. I think today what we're hearing is that there's such clear evidence that there is a health and housing link. And overwhelmingly, we're hearing that there's opportunity for cross-sector collaboration. It's not one group, it's not philanthropy alone, local government alone that will do this. And we heard that with what the Oregon Health Authority is doing, how ARPA funds are being used in collaboration with local jurisdictions in St. Louis, and that's all promising. Something for all of us who are here today and those that we interact with is to keep talking about this, to keep thinking about how we collaborate, how we find solutions together. Ed reminded us to break through the get tough political narrative and to replace stereotypes with humanity. Amanda said to name problems and not solutions. And talked about naming the ways that existing policies and practices uphold structural racism, and the fact that people can rebuild policies and practices in a more equitable, community-centered way. Jasmine talked about conversations happening across St. Louis, across sectors, to change the narrative of where impact of and responsibility calls for us to do. And Steph is previewing some of the exciting work happening in Oregon that will launch in just 7 weeks, that we will check back with you in 3 months to ask how this is doing. So thank you very much, everyone, for staying tuned. And there will be potentially some follow-up that we send out to all of you. There were some questions, some links and resources, and maybe we could just call that together and get it all in one place. So everyone, go forward, enjoy the rest of your days, and we look forward to connecting again sometime. Thank you.